Hello beautiful people, welcome again to the channel. So we'll be talking about preeclampsia today. What is preeclampsia? And I'm not going to take much of your time, but I would like you to follow me to the end of this video. I'm making this video because of the stories I've read, have seen people ask what is preeclampsia, have seen or have also read or stories where either the mother died or the baby died. In fact, there's this sad story I read about I was told, not read actually, a friend shared with me and she gave me permission to share about a pregnant woman that died of preeclampsia. I'm going to share that story in my next video. So what even happened? So why? Let me even share it here. Why the next video? So this particular lady registered for antenatal, I think in a private hospital and also a government hospital, and she was being managed. However, she developed preeclampsia after delivery, and after the delivery, the baby, she developed preeclampsia, and she was not properly managed. Sadly, she passed. She died. And the person that shared this story with me took charge of the baby and was taking care of the baby. But after some weeks or months, the baby also passed. Also, I also saw a story recently on social media. Obviously, anything I share on this place is something I've read or something I've been told and I got permission to share, not like people I attended to. Okay, it's very important to take note of that. So I read on social media recently about a lady that lost her baby because of preeclampsia. Now, it's very important we get to know about it. This is because when you know something, you're watching out, and then you'll be able to take prompt decision and proper health care, because preeclampsia can be managed and the complications that come with it can be avoided if it is detected on time and appropriate care given. Okay, so what is this preeclampsia? First of all, preeclampsia is a medical condition that affects pregnant women in their second half of pregnancy. Okay, that's to tell you that it does not occur in the first part of pregnancy, first trimester. We got to talk about preeclampsia from the second trimester, after 20 weeks of pregnancy. Okay, so what happens is that when you go to hospital as a pregnant woman, they check your vitals in at that the beginning, right? One of the vitals they pay attention to is your blood pressure. That is one. Then secondly, they do urinalysis. What are they looking for? They are checking if your blood pressure is high. They're also checking the protein in your urine. Okay, so now after 20 weeks, when a pregnant woman begins to develop high blood pressure and protein in urine, we are talking about preeclampsia. And that is why you need to pay attention when you go for antenatal or clinic and care in facilities where all the people have the skills needed. It may not be much of a problem because they tend to do these things, but some places these things may just be neglected. Okay, and you as a patient or as a pregnant woman, you should be fully aware so that you'll be able to take charge of your own health, right? So basically, hypertension and protein in urine in second trimester of pregnancy, after that, like after 20 weeks usually, it's preeclampsia basically. Now, what causes this preeclampsia? The cause is not known actually, but we still try to blame the placenta and then things that just happen. Okay, so we do not know the cause exactly. Now, you may be asking, am I at risk of getting preeclampsia? Well, I made a video where I gave the list for the risk, or the list of women that are at high risk of getting preeclampsia. So go check that video to just watch to see. Okay. Also, what are the signs and symptoms of preeclampsia? The things you can watch out for, so that to see how this can be prevented. Okay, or the things to watch out for to know when to seek medical help. as a pregnant woman, especially after 20 weeks, and you come up with headache, that this bad headache that would not go away, please see your doctor, call your midwife, see your GP, seek medical care immediately. Okay, because preeclampsia can present with headache. Another thing that it can present with is blood vision. So you can have some blood vision or any issue with your eyes as a pregnant woman that was not there before. Please also see your doctor. It's very important. Another thing you have to watch out for is when you see your body swelling. It can be that your fingers are swelling. How would you know that your fingers are swelling? If you wear a ring and say the ring becomes tight compared to what it used to be before, it may tell you that your fingers are swollen. Sometimes your face may also be puffy and swollen, and also swelling on the ankle, on your feet. Okay, that's your ankle area. These can be signs of preeclampsia. Now, if it is also bad, it can cause abdominal pain, just below your rib, the gastric region. It can also present with pain. So if you notice any of these things, please see your doctor. Okay. Another thing that can happen with preeclampsia, it's if it's not properly managed, it can get complicated. There can be complications, and that will give you that is when the person develops what is called eclampsia. And eclampsia means seizure. The pregnant woman begin to have seizure. So this is a very serious condition that needs to be paid attention to. I just hope that I've been able to make us understand what, in simple terms, what this preeclampsia is, and so that you as a pregnant woman will be aware. But wait, have you subscribed to our YouTube channel? Have you liked? Give us a thumbs up, leave us a comment, and I'll see you in my next video. Bye.